Those who are new to the quiz, kindly join the quiz with the link that is given in the comment section of the YouTube live video. Also, link is given in, uh, you can also join the link using the QR code that is displayed on the screen. Also, the link will be shared in our Telegram group, JuxtaMed Official and Dr. RMD NEET PG Guidance Group. Kindly join the quiz quickly. We are going to start exactly at 10:10 p.m. So today's topic is general pathology. Since yesterday we have started with pathology. Yesterday and today, 2 days, we had given time for you to prepare for general pathology. Since general pathology is a very important topic, that's why we had given 2 days. And at the end of 2 days, we are going ahead with this quiz. So there are only two very important topics in pathology. One is general pathology, and second is hemato-oncology. Many number of questions are being asked from just these two topics. That's why we have kept this topic now. We have given more important. That's why we have kept these two topics for the first 4 days out of 7 days that we have allotted for pathology.
Sir, is the importance same for INICET also?
Yeah, it is almost the same. But INICET focuses more on like
Okay.
image-based topics also and some rare things also. But all, if you see all together the picture, general pathology and again this one, hemato-onco carries more significance in INICET also.
Mm-hmm. Guys, those who are watching us on the live stream, you can join the quiz and later you can come back and see the video for any explanation if you need.
Everyone, please join the quiz quickly. We are going to start in 3 minutes. At 10:10 p.m., we are going to start exactly. I think people are waiting for 10:10 p.m. We have seen that around 10:09, the participation increases exponentially. I can see some. I can see many familiar faces. 1G Reddy, Soumya, Ben
Doctor,
Stokes,
yes, Doctor,
Docro. Yeah, Docro was
Ben
winner for
Stokes.
I think two quizzes in OBJ maybe. Shanmuga Priya, RDT also.
RDT, we have Krishna, then Soumya, yes. There's no
We can
neurosurgeon today.
yeah. We can see some new faces also. Bipasha, Deepshika, Naga, Amygdala. Vishnupriya, I think, has joined, but we can't see her name over. Or L
think
carnitine.
our display is here.
L carnitine.
Oh my God, I think.
We should also announce one prize separately for the most creative name. There is one Divya, there is one Nivya. Okay, one more minute to join, guys. Join quickly. Okay, I think we are good enough to go. Let the players join as the quiz
Yes, sir,
proceeds.
we'll start.
Yeah. So welcome everyone to another exciting round of JuxtaMed quiz. So today we are testing your knowledge in general pathology with some tricky questions. So this will be the part one of pathology series. We have started with general pathology because it is the most important topic, and we have given you 2 days to learn general pathology. So let's move ahead with today's quiz. Here is your first question. Which of the following is an example of coagulative necrosis? A straightforward, easy question. You can't afford to make mistake here. There's no way you can make mistake. Even if a single person has made mistake, I suggest the person who has made mistake immediately leave the quiz, go back and study patho.
Yes, I think this is the first concept we read in general path.
These people who have answered it wrong, pancreatitis, TB, brain infarction, go back, leave the quiz.
Guys, can you tell us what is the type of necrosis in brain
Yeah,
in the YouTube comment section, if you
tell
can?
me, tell us in the YouTube comment section. We'll give you a shout out. Okay, so points are almost three of them are leading. Oh my God.
Hmm. Okay, moving on to the second one. A 5-year-old boy presents with recurrent viral infection, albinism, and CNS dysfunction. Peripheral blood smear shows giant granules in neutrophils. Genetic testing shows mutation of the list gene, LYST gene. What is the underlying defect responsible for his recurrent infection?
So again, a very important question, very easy. Two things are connected here. One is patho, the other is biochemistry of the cell. Okay. So if you know these two, then you can get to the answer. Yes. The answer is defective fibrinolysis fusion. So anyone in the YouTube live comment section wants to answer what is the diagnosis of this case? What's the diagnosis? Let's see scoreboard. Itachi is leading, followed by RDT, Urvashi, Docro, and Reddy. Moving on to third question. 10-year-old boy presents with excessive lymphadenopathy and splenomegaly. Genetic testing reveals a mutation of PAS gene, CD95. Which of the following processes is defective in this patient?
So here, to give a clue, this pathway is very crucial for eliminating the self-reacting lymphocyte, and its failure can lead to an autoimmune lymphoproliferative syndrome. So think about the important mechanism which is responsible for this.
Yes, so most of them have answered it right,
Yeah.
apoptosis. So what is the diagnosis? You can mention in the comment section, YouTube live comment section. For previous question, Tanya has provided the right answer in YouTube live comment section. That is Chidiac Higashi syndrome. Very good, Tanya. For this question, can you please answer what is the diagnosis? Let's see leaderboard during that time. Urvashi and RDT are leading with few point difference only, followed by Reddy, Ben Stokes, and Nivea.
And the fourth one, a 45-year-old woman presents with a thyroid nodule. FNAC shows orphan eye nuclei, nuclear grooves, and concentric laminated calcification. Which of the following best describes the calcification seen in this tumor?
So again, general patho question with the fine touch of endocrine. So this is about calcification.
Yeah,
So
can you guys tell us what are the other condition as well?
yeah, orphan eye nuclei. I think no one is supposed to miss this. Orphan eye nuclei.
Hmm.
So RDT is leading now, followed by Ben Stokes, L carnitine, Itachi, and R. So moving on to
Okay,
the next
here's five,
question.
6 more questions.
25-year-old male presents with fever productive of dyspnea for 3 days. Sputum shows gram-positive diplococci. So basically, it's pneumonia. Which of the following is the primary function of neutrophil extracellular trap in fighting this infection? So you have four options.
I think this is a PYQ question, and to give a clue here, these traps act like a sticky webs released by the neutrophils to capture and kill the bacteria. So here the question is asking you what is the main mechanism here, the primary role.
No
Yes.
doubts. Everyone has answered it right. Close knit competition between RDT and Ben Stokes, followed by Itachi and L-carnitine. Moving on to sixth question.
Okay, moving on to the next one. A, okay, a pedigree chart of a family affected by a neurological disorder is given below. What is the most likely mode of inheritance?
So if you notice here closely, all affected with females, all females who are affected produce offsprings with symptoms. All males who are affected have healthy children. So this itself is a clue. I don't know why some people have answered it autosomal dominant, maybe because it is present in all three generations. But remember, once you see pedigree that is
Yes, sir,
affecting all
maybe.
three generations, you should always see whether there is male or female predilection. That is the second step. First, you'll see whether it is skipping any generation, and the second step is whether there is any sex predilection. If there is any predilection towards male or female, mainly female producing affected offspring, then always think mitochondria. You're not supposed to make mistakes in this, guys. There is no scope for mistake in this at all. So if you have answered it wrong, then you should definitely go back and revise the whole pedigree. Seventh question. Young woman is suffering from an autoimmune condition since many years. Which of the following gene is not involved to cause this condition? So basically, they're asking which gene is not involved in autoimmune conditions.
Yeah, in these, out of four options, three are very important gene, which is known to cause the autoimmune disease. So of
And
the
one out
gene
of
is
one
not
of this,
related to
even if you don't know the answer, one of this itself AI stands for autoimmune.
it.
Yes.
Yeah, we have got a mixed answer.
It is leading, followed by Itachi, Vanji, Urvashi, and Elkanite.
Okay, a 26-year-old woman presents with fatigue, joint pain, and malar rash. Laboratory tests reveal positive ANA. Which of the following antibodies is highly specific for this condition? So give the diagnosis and tell us what is the most specific test done here.
So if you know the diagnosis, it's like non-specific symptoms like fatigue and all, along with joint pain, malar rash, and positive ANS. So if you apply Euler criteria or ACR criteria, so you'll notice that there should be few clinical features and few laboratory features to substantiate diagnosis of SLE. So once you do this, you do an extended nuclear assay, okay, ENA profile, and there you will get few antibodies, and out of this, the most specific is anti-Smith antibody. So anti-SS row is specific for which? Kindly mention in the comment section. It is very important, even from medicine, okay. Anti-histone is specific for which, and anti-DSDN is specific for which? Kindly mention in the YouTube comment section. Okay, so Thea has answered anti-Smith. Yes, correct. You have answered it right, and the diagnosis is SLE. Please mention other antibodies are for which conditions. They are specific, okay? Although they can be overlap many times, but these antibodies have specificity for few conditions. Yes, Sweetie has mentioned correctly. Sjogren is for Rola antibody, correct. SSA Rola antibody is for Sjogren. Another is for neonatal lupus. Okay, that is also SSA and SSB. That is Rola is positive in neonatal lupus also. Anyone else want to comment for anti dsDNA and anti-histone? In the meantime, we'll move on to the next question. 65-year-old man with end-stage renal disease on long-term dialysis presents with progressive carpal tunnel syndrome and joint pain. Biopsy shows amyloid deposit as stained with congruent, which is the protein is most likely responsible for this condition.
So here, this type of amyloid comes from a small protein that accumulates in the patient on a long-term dialysis and is often linked to joint and tendon problems.
So most of them have answered it right. Beta 2 microglobulin. So the point score remains almost the same. Itachi leading, Urvashi followed by 1G, RDT, and S.
Okay, guys, moving on to the last question. 32-year-old man presents with chronic lower back pain and more stiffness that improves with activity. X-ray of the sacroiliac joint show sacroiliitis. So genetic testing is most likely to reveal an association with which of the following HLA alleles?
So this history that shows sacroiliitis with morning stiffness. All these point towards inflammatory or rheumatological uh, pointers. Okay. So basically, they're asking for ankylosing spondylitis, which HL is positive. It is very, very important question. It is HLA B27. One more question that they can ask is HLA B27, which method is very specific for identifying HLA B27 positive spondylosis arthritis? And the answer is by PCR. Okay, when we do the polymerase chain reaction, that HLA B27 positivity is considered. Okay, so that can be a question for future NEET PG entrance exam. So in the comment section, we have Thea who has answered that drug-induced hepatitis, drug-induced SLE is specific and for antihistones. Okay, good. And also has answered correctly for HLA B27. Okay, so at the end of this quiz, we have Itachi who has won this quiz with 742 points. Congratulations.
Congratulations, Itachi.
Followed by Urvashi, Parashar, and Vanji at second and third place. Congratulations, guys.
Yeah, congratulations.
Okay, and we have RDT who is at fourth place. Yes, at fifth. Krishna at sixth. L. Carnitton at seven. CK at eight. Ninth Rathod and 10 bench tops. Congratulations, guys. Come back to YouTube Live. Let's have a short
Yes.
discussion. So, how was this quiz? Let us know in the comment section if you have any doubt. Yes, Shanpayan has answered it correctly. Yeah, HLA DQ2 is for celiac and HLA DQ3 is for SLE. Okay. So I guess you have finished general pathology by now. General pathology was one of the most important topic. Very frequent MCQs are being asked from general pathology. That's why we had given 2 days. Tomorrow and day after tomorrow, you'll be preparing for hematonco, and on the Wednesday night, you will be having quiz on hematonco. Okay. So hematonco is one more topic. In last NEET PG, highest number of questions were asked from hematonco only. So if you have any doubts, we'll be waiting for you, or else we'll be winding up the session. We'll be meeting you on day after tomorrow at 10 p.m. Anything you want to add, Manoj?
I think not any, not much, sir. I think we have covered important topics, I guess.
Yeah. Okay, fine. So we'll be winding up this session today. We'll be seeing you on Wednesday at 10 p.m. again on hematonco. So prepare well, and pathology is very important topic. So prepare well, and we'll be testing your knowledge. Till then, good night.